But this clinical trial was an investigator-initiated trial supported by the NCI and CTEP. And it was based on the preclinical data from our lab showing that combination of Entinostat, one of oral Histone deacetylase inhibitors, had a synergistic effect in combination with high-dose interleukin-2 in mouse model of kidney cancer. So we were able to translate these biological results in a clinical trial in a patient with the clear cell carcinoma, where high-dose interleukin-2 in a selected patient population might be an option. Today we have been accrue 47 patients through a phase 1, a short phase 1, and then a phase 2. Some patients had, 4 patients were not available for efficacy, but we included all patients for toxicity assessment. And there are still some patients that haven't completed the first cycle of therapy, that is 85 days for tumor assessment. Well, we've been encouraged to see an objective response rate that is approximately 35%. We had so far 10 patients with partial response and 3 patients with complete response, and a median progression-free survival of 16.1 months. So this is as compared to historical control with the high-dose interleukin-2 alone, is promising because the historical data suggests more a 25% response rate, although based on the WHO criteria, and a median progression-free survival of 4.1 months. Toxicity, high-dose interleukin-2, of course, is a quite toxic regimen. Patient needs to be admitted to the hospital, but we haven't seen an overlapping toxicity between the HDAC inhibitors and high-dose interleukin-2. For example, we saw hypophosphatemia. This is a class effect from HDAC inhibitors, but we haven't seen increased cardiac toxicity, hypotension, or the traditional toxicity that will be seen with the high-dose interleukin-2. So overall, we believe this combination is relatively safe. Of course, has to be given in centers that are equipped to give a high-dose interleukin-2. But I think this is the first example of we call an epigenetic therapy that can modulate immunotherapy or other traditional therapies. And so we're very excited that perhaps this, we believe, a positive result. Of course, it needs to be validated probably in a larger randomized trial, but it really sheds some light on the potential of using epigenetic drugs, drugs that affect the epigenome, the gene expression, as immunomodulators. So as immunotherapy is becoming really the standard of care for several diseases, we believe that this example of combination with high-dose interleukin-2 provided really the platform to test also some additional combination strategies, not only in kidney cancer, but also in other solid tumors.